spotlight on an issue that concerns a lot of people around us, especially if you're a parent. Pediatricians and gynecologists from across India are reporting a rise in precocious puberty, meaning young girls and boys are hitting puberty early as 7 years of age. Doctors were seeing it so rampantly that they have taken the matter to ICMR, the Indian Council of Medical Research. And based on that, their anecdotal reference and the details that the doctors brought, there will now be, this year itself, a study done, a first national level survey to assess the degree of prevalence of this matter. In America, for example, when a similar study of this manner was done by the American Academy of Pediatrics, they stated that while the average age of puberty there was 16 or 17, the average age for a period for a girl to get her period is about 12. There is also, however, a lot of myths attached to early puberty. The younger you are, the more confused one is likely to be about what's really happening to your body, also what's happening to your mind. Also, so many hormones come into play. There is also, in addition to that, a lot of stigma and silence around it. So let's break that today on the program and discuss early puberty in detail. What exactly is it? What are the signs? And importantly, why is it happening? Let's decode. Let's first start with what exactly is precocious puberty. Now, puberty is defined as a presence of a secondary sexual characteristic, breast development in girls, pubic hair, and testicular penile enlargement in boys as well. Now, precocious puberty is usually defined as an onset of puberty before the age of 8 in girls and before the age of 9 in boys. It has been recognized that on an average, African Americans, Hispanic girls as well, they start puberty somewhat earlier than, say, white girls. That's why the Indian subcontinent also, you see the age being lower than the Western average, but of late it's dropping even more. What are the signs then, if you're a parent concerned, that you should be looking at? Let's talk about girls first. Progressive breast development, growth acceleration and early menses, usually 2 to 3 years after the appearance of breasts. That should be a sign that puberty is about to hit. In boys, penile and testicular enlargement, increase, sort of body hair, growth, acceleration, deepening of the voice as well. That's supposed to be a major telltale sign. That should tell you that puberty is about to hit, and that should be the time when you start having those conversations with your kids. But the important bit is, why is this happening? And is there a downside to it? Now, most times when puberty occurs early, it is merely a speeding up of the normal process. In other words, the alarm rings too early because the clock is running fast. When we are looking for causes or explanations, it's not just one thing, it's a multifactorial approach. Really, for example, obesity is said to be known as one of the reasons why there is a rise in the risk of early puberty in girls, and childhood obesity rates are very high, especially in India. Stress said to be another factor. Yes, it's a factor even in young kids. And that could be intertwined. When we have higher stress, you have higher sort of cortisol levels, hormones, we get higher sort of androgen hormones as well, and all of this leads to early puberty. Endocrine disrupting chemicals, the third factor, as many have pointed out, that is widespread in environment and is also likely to play a role. Now, there are also examples of chemicals that are these days present in cosmetics, in personal care products as well, that could be interfering with your hormones and can cause early puberty. Also, and this one really scared me, some air pollutants are also known to disrupt your endocrine system and thus bring in an early onset of your development. Now, having understood that, let's bring in our guests on the program now. We wanted to give you a full 360 approach on the subject. So we have with us Dr. Ganesh. He's a pediatric endocrinologist at Max Super Speciality Hospital in the National Capital. Good morning to you, Doctor. He is one of the best known pediatric endocrinologists in the country, and we want to pick his brains on why this is becoming so rampant. We also have Kavita Devgan with us, a health expert and nutritionist. So when we say that it is caused due to obesity, we want to understand how we can reverse it. And then we also have Shrradha Sindhwani with us. She is a psychologist, because when it comes to puberty, it's not just about how what's happening to your body, but how you're feeling. And a lot of times parents don't know how to deal with the subject. So we'll understand that from Shrradha. First to you, doctor. I want to understand, having understood how this really works. Now, you know, historically, compared to the West, Indians sort of have an average age of puberty hitting us a little early. What I want to understand from you, Dr. Ganesh, is what exactly is the downside of hitting puberty early?
Thanks, Sonal, for having me here. Just before I answer your question, just would like to qualify that often people understand puberty as menses. I mean, when we say puberty, puberty process is the start of pubertal process in girls is indicated by breast development, and menses is often the end point. So this concept is very
Right.
important to be understood. Now, the flip side of having precocious puberty is that as a clinician, the first question that comes to mind is whether the precocious puberty is being caused by any disease or any problem that is happening either with hypothalamus pituitary or sometimes with the gonads or sometimes hormone introduction from either outside the body or in the form of some drugs or chemicals, etc. So first medical question is whether it is a sign or symptom of a disease. The second question which bothers most parents is what is the expected adult height prognosis? Now, if the puberty starts very early and if it progresses very fast, then it is likely that the bones, our height increases because of increase in the length of our bones, long bones. So because of the effect of sex hormones, these bones would fuse prematurely, and that would lead to loss of adult height. So that is one important medical aspect to it. And the third aspect, of
Okay.
course, is psychological or psychosocial, where the girl or boy is having peer inappropriate changes. The psychology, he or she may feel too different from his or her friends. And also, secondly, things like romantic attractions or sexual interests or behavioral changes may be seen way too soon than the normal adolescence. So these are the main issues that
Okay.
are seen whenever there is a problem of precocious puberty.
Okay. So, Dr. Ganesh, you're saying that if your child, for parents watching us right now, if your child is hitting puberty earlier than, say, the average age, which is earlier than 10 years on an average for boys and girls, then do see a doctor, do see an endocrinologist, because they need to do some basic tests to see if this does not mean something bigger. That's number one. Height might be compromised, you're saying, is number two. And third, you're saying is that if they do indulge in conversations, then we've got to know how to sort of, you know, have a safe way and a safe environment of having those. But when it comes to puberty or any sort of sexual conversation, there are so many myths attached that I really want to, you know, bust with you, Dr. Ganesh. There are, you know, reports also that suggest that if you have puberty early, there could be an increased risk for breast cancer. Is there any evidence for that?
Well, there are some epidemiological associations. They are not cause and effect associations of early puberty with some cancers. I wouldn't say there is a cause and effect association. But when we say epidemiological association, that means that if you study people with breast cancer, there would be a slight increase in those who have had precocious puberty.
I see, I see. But no direct evidence per se does
No
not
cause and effect
directly
link.
put you at risk, is what you're saying.
Yeah.
Okay. The second question that is often asked is that does spicy food lead to periods? This is also another myth that has been going around since I was in school.
Yeah. Uh, I don't think there is any evidence for linking spicy food with precocious puberty, but certainly there is an association between obesity, intake of sugars, intake of refined carbs with the pubertal onset. So anything which can sort of cause insulin release or insulin resistance could be linked with precocious puberty. Now, this became particularly prominent during the COVID pandemic because many of these children were sitting at home. They were having probably excessive caloric intake than their physical activities, and also a lot of stress and screen exposure. So, and many countries, and including in our own practice, we saw a lot of cases of precocious puberty or girls coming with menses something like 8 years or 8.5 years and 9 years, which we had not seen before. So clearly, there were a lot of lessons to be learned from the COVID pandemic in terms of the environmental factors affecting the precocious or affecting the pubertal development.
Right. Also, doctor, some girls have very intense period pains and symptoms. Some just take it as a breeze and even go play an Olympic, while they are chumming. So, are we to read into that? Has that also got to do with the way your body is functioning?
Typically, when the menses begin, in the first year, many of the cycles are not associated with ovulation. Something that kind of takes a little more time to kind of mature and be a regular feature. So these kind of cycles can be associated with some irregularity, like periods happening too frequently or maybe less frequently also, and also a significant amount of pain around the cycles. So some amount of irregularity is common in the first year following the onset of the menses. But if it is something like heavy bleeding, which could cause drop in the hemoglobin and anemia, then a medical opinion needs to be sought. And if the pain is significant and interfering with the daily routine of the child, then help needs to be taken, and probably pain relief medications may be required.
Right. Let's turn our focus to boys there. As a society, we sort of celebrate a man or a boy coming of age, but when it comes to a girl, somehow it's always kept in the back burner, don't talk about it, etc. But I'm sure even boys, the conversation is, not much even at homes these days. Do you see any particular telltale signs that parents of boys should watch out for, and in a situation that they should see a doctor?
Yeah, firstly, I agree with you that there is a lot of awkwardness when it comes to talking about puberty. Even with parents, sometimes parent-child conversations or teacher-student conversations, there is a lot of awkwardness, and probably it needs to change for us to openly discuss these issues. Secondly, with respect to boys and girls, the problem of precocity is clearly much more common in girls. We see like something like girls present with this problem more than 10 times than that of boys. Now, the main problem with respect to boys is that in boys, if there is a precocious puberty, there is a higher chance that it is resulting from an underlying brain or neurological disease. So almost 50-60% of boys may show some sort of a problem, some sort of underlying disease, which could be presenting as precocity. Another difference in boys is that in girls, the change of puberty is breast development, which is very evident, which is like if the mother is careful, observant enough, the change is very evident. Whereas in boys, the first change that happens is the increase in the testicular volume, which often even a general physician may not pay a lot of attention to. So, if as in India, in many families, we see that the parents continue to give birth to the child. And in case, during any event or during any examination, if you notice that the testes are enlarging, the penis is enlarging, before at the age of 9.5 years in boys, that needs to be paid attention to. And as you say, the deepening of voice, of appearance of mustache and beard, these are actually later signs of puberty in boys. This happens towards the end of puberty in boys.
See.
So by the time this happens, you may already kind of have, you may already be late, actually. So the first change that happens is testicular enlargement and the enlargement of penis.
Right, right. All right, Dr. Ganesh, thank you so much for answering all those questions and letting us know a little bit more in detail. I think this is quite educational, but we've understood why this is caused, what happens when it is caused. But a major factor, like we said in our explainer as well, is the diet that kids these days are consuming. And I want to bring in Kavita Devgan next, who's a health expert and a nutritionist, to sort of tell us more about this. Kavita, obesity said to be a leading cause. That means what our kids are eating right in their early years. I mean, if we're talking about kids 8 and 9, and they're really kids at that age. That means they're not getting the right kind of food in their early years. Could you tell us what is a proper construct of a diet or division of diet when it comes to kids that young?
Hi, good morning, Sonal. Yes, as Dr. Ganesh mentioned, that is actually one of the major causes. Besides, of course, if the medical reasons are ruled out, obesity or overweight is a major cause for, early puberty in most children, mostly in girls, but yes, and sometimes in boys as well. Um, it's not just at age, Sonal. It's actually what the child eats from the time the child is born. And in some cases, studies tell us that even in the gestation period when the mother is pregnant, so between 3 to 7, the kind of diet a child has been eating will have an impact on a lot of things and possibly on early puberty as well. So keeping your child's weight at optimum literally should be non-negotiable for every parent. Hook or by crook, they need to make sure that the child is not overweight. And for that, they have to ensure that the diet that they give to their child is primarily home-based food. Why I'm saying that is that another very common risk factor which has been noticed over the years is overconsumption of junk food, packaged food, and processed food. Because of the direct links high in sugar, what Dr. Ganesh mentioned, which leads to insulin resistance and inflammation in the body, which has a direct, link to early puberty because of, being a hormone disruptor. High saturated fat, again, which has a direct link. And also, sometimes there are, in fact, many times, there are many additives, coloring agents and other compounds in processed and packaged foods, which are also hormone disruptors and endocrine disruptors, which again could lead to early puberty. So making sure that your child is at the optimum
Kavita,
weight
the thing is
and
that
eating the right food.
Story after story that we do, and we talk about what is the leading cause of any kind of problems in our body, I see all nutritionists, all doctors just gravitate towards one thing, which is stop eating out. If it is home cooked, if you know what you're eating, ingredients are at least the ones that you identify, that itself will solve a lot of problems. And this is yet another example of how to make it right. But I want to bust another myth with you, Kavita.
Yeah.
Some households, and we know there are still a lot of these unsaid rules that mostly are applied on the girls when they hit puberty or about to in that age. They are put on this special sort of a period diet. Is there any sort of historic wisdom to it, or do you think this is something we must just do away with now?
No, see, I would much rather that we focus on the macros first. If you are not controlling the macros, which is making sure that you are sure of where you're sourcing your food from, because besides the ingredients, nutrition quality, it's also the safety, the hygiene, and also, ensuring that the food that you're sourcing is free from antibiotics, because that today is also a huge problem. Antibiotics and hormones and everything. Making sure of this first is much more important than trying to put them on a strict period diet. That comes much later. If at all you want to do it, that's fine. If there's wisdom, if there's traditional wisdom you want to follow, that's great. But first, make sure that your child is eating food, or as a parent, you're ensuring that you're sourcing food that is not just nutritionally sound, of right amount of calories and proteins and fiber, the macros, but also safe. Because we also need to go beyond just food. We need to look at the packaging. A lot of times, and in many cases, it's also a lot of chemicals in our environment which are the cause. The common ones which everyone has heard about these days is BPA. Then there are phthalates. Then, the non-stick pans which have PFAs in them. All of these also leach into the food that you're giving to the child. You might be giving the best of the food to the child, but if you're preparing it wrong, you're also giving them chemicals which are endocrine disruptors. So it has to be a 360-degree approach where you're looking at the source of the food, you are looking at how the food is served and packaged and delivered to you. So you have to be extremely careful.
Right, that's a very, very good point. Even Yeah, that's a very good point, and I'm very glad that we've touched upon this topic. Even the utensils you use and the oil you use in your house contributes to this, and we've done a separate episode on this altogether. Really urge our
Yeah.
viewers to sort of go back to YouTube and search them. There is a detailed sort of itinerary on what each utensil that you use in your house should be used, how it should be used, how it should not be used, and when it should be replaced. So thanks, Kavita, for that. Let's bring in our next guest, Shrradha Sindhwani. She's a psychologist. And Shraddha, if somebody is aware, somebody is trying to do the right thing and still facing with something, facing early puberty at home with their kid, as a very concerned parent, what is your first port of call? What is the kind of conversation you should be having with your boy or girl?
Good morning to all the viewers. The first point of conversation I really want to stress on is the communication angle. So it is very overwhelming an experience. So for the girl to get her first period, or for the boy, to have changes in his voice, get facial hair, even having a morning erection, these are very overwhelming changes for the child. So one has to understand from the little boy as they move into the adolescence change, it is extremely anxiety provoking. Many a times they also feel guilt, and they are not able to express their emotions. So these emotions need to be spoken about with the parents. And while the child is talking about these emotions, it is very important for parents, please do not dismiss the emotions, let them speak it out. Many a times parents also see that the children are getting very defiant, they seek their independence, they want to make their own decisions. So let me stress that this is a phase where the child, moving from the obedient young boy and girl, our son and daughter, tries to seek their independence in the world. This is also a stage where through the changes of puberty, they have desires such as, liking somebody, liking the opposite sex. So these are sexual desires and urges which are very normal in their period of development. Psychologically, we view this as very normal. This is also the phase where you identify your sexual identity and your orientation. So I think what parents need to do is have these conversations with their child. While the child is also going through these changes, they may have a lot of self-doubt, they may question their body, they may not feel that they're looking good. So it is very important for us to build their self-esteem, have these conversations of self-belief, what are your strengths, what are your weaknesses. So other than looking just as the external characteristics, look at the internal characteristics, what they are good at.
So Shraddha,
art,
what
music,
you're saying
academics,
is that it's important
sports.
it's important to educate then the caregivers, the parents and the care providers, because how they have that first chat with the child could set the tone for the months and years to come. We understand today that a lot of schools do very active sex education and talk about this, but the environment is not really as close or safe as maybe your own house. So if, say, a daughter or a young girl who's just had her period, or the early signs have been missed, and they walk up to their mom and they, visibly scared, want to understand what's happening, what is an ideal response that a mother should have?
So I think the first ideal response with either a girl, especially girls, because we've seen that they are more emotionally sensitive. We've seen girls are more critical of themselves and how they look. So the first physical response should be a warm hug. The second response would be, if your child is very overwhelmed, anxious, to just give them some breathing exercises, allow them to breathe, ground them, do a little bit of mindfulness, as we call it in psychology, just sit them down and take them through this conversation of what the puberty is actually, as we had the two other speakers speak about it, and what the changes potentially be. But while we are discussing the physical changes, it is also important for the parent to stress that there may be a lot of emotions such as anger, frustration, irritation that the girl may go through prior to her period, as we call it, or after the period. So, how does one deal with that frustration, anger? How does one deal with conflicts that will come, in the environment. So a lot of times we see lot of mood swings and parents reporting a lot of mood swings. One alarming feature I would like to specify here is if the parent is seeing that the child is becoming too detached, too withdrawn, or closing down, putting very strong boundaries of not allowing any conversations, please make the added effort to go and speak to your child. So do not let your child completely, stonewall himself, because that may not be psychologically safe for the child. With a lot of social media content out there, we have seen high rates of sexual addiction and exploration online. So it is very important for us at this stage to have these open conversations with, both boys and girls.
Yeah. Shraddha, a very important point,
allowing
and this
them
is what a lot of
to
people
be-
are talking about as well, to say that there is, kids these days are exposed to a lot of content which is not age appropriate. I mean, just the fact that it's playing in the household, or the fact that it's being watched by people, will gravitate them towards this kind of a content. So you are essentially saying that
Right.
the parent should be the one introducing them on this journey and setting the tone. I love that you said just start with a hug, start there and then take them through the process.
Yeah. Yeah, I definitely think that parents need to understand that whether we are aware about it or not, kids have probably heard about these things. They have seen it on their social media feed, So while we are talking in classes, while children are talking to their mentors, their friends, they may have this content especially running through their feeds on Instagram and Snapchats and things like that. So it is very important for parents to introduce what is healthy and unhealthy. And so the child starts accepting themselves and, they explore in that way. So once it comes from the parents, we do understand that, children are less likely to fall into an addictive trap. But many a times we have to understand at this age, the child also over-identifies with certain conflicts, with certain problems in their head. So this is a very, very important phase for anxiety and depression that we see among youth. And we have seen a lot of that, through COVID and even now. So it is very important, have these very clear conversations with your child, establish boundaries while you're having these conversations. But many a times, Sonal, what parents report is they feel very awkward to have these conversations. But there are a lot of YouTube channels, there are a lot of books that can tell you. We've also published a book on this, and so there are a lot of reading material that you can take, sit down and discuss the psychological impact of puberty.
Sure, sure. All right, Shraddha, thanks so much for that. And I think it will start with conversations at home. That's how myths will be busted. That's how these very traditional ways of looking at puberty, even your period cycle, will actually end. And it all starts with a lot of responsibility on the shoulder of parents over there. All right, with that, we hope we have given you a conversation starter for your next chat with your kid if the age is right. We'll